Happy New Year 2025. I believe all of you are well. I welcome you back to this new year. My name is Cynthia Capesa. I'm a clinician for a decade now. So today we're going to discuss about hypertension in pregnancy, which is also known as preeclampsia. So as you well know that hypertension in pregnancy is the most common complication during pregnancy. It has led to increased maternal and perinatal morbidity and mortality. A BP that is more than 140/90, 140 being the systolic and diastolic. So actually you will find most women during their prenatal visits, they are getting BPs of about 170, 85, which is quite high in early pregnancy. So it normally occurs in women known to be hypertensive and those that develop hypertension in the second half, or let me say the second trimester of pregnancy. So what are the risk factors that lead to preeclampsia? Number one is null parity for those who are getting pregnant for the first time. Number two, it can be a history of preeclampsia in previous pregnancies. If you had a previous pregnancy and you presented with high BPs, there's a likely chance that you will present again with preeclampsia with your second or third pregnancy. Ages of above 40 years and ages of less than 18 years. So the senior ones and the younger ones. If you're above 40 years and trying to get pregnant and God blesses you with a pregnancy, well, there's a likely chance you might end up with high BPs during that pregnancy, which is expected. And if you're very young and you find yourself pregnant too, you are at a higher risk of also getting high BPs. Familial history of pregnancy-induced hypertension, yeah. If your mother had the same issue, then as a woman you're most likely going to get it. But it's not a guarantee that it's a must, but it has a trend in families. So that can also be a risk factor. We also have renal diseases. If you're having issues with your kidneys, there's a likely chance during pregnancy you might end up having high BPs. Diabetes, yes, diabetes is also another culprit. If you're diabetic, you really need to take care of yourself when you get pregnant, and you'll see that your visits will be more as compared to someone with just a normal pregnancy and has no issues. Multifetal gestation, this means if you're having twin or more pregnancies, these are people who are getting twin pregnancies, triplets, name them. Those people have a tendency of getting high BPs because of having more than one fetus in your uterus. High body mass index, yes, those who are overweight and obese have also a tendency of having high blood pressure when they get pregnant. And also unexplained fetal growth restriction. There are those who get pregnant but their fetuses tend to have restriction in growth or retarded growth in the uterus. So those are the main risk factors. So how do we manage this? Management is general and with medical treatment. Once you go for your antenatals, you need to be checked. Antenatal visits are very important, and I encourage women to go as early as they can, because you never know, you might be seated in the house thinking that you're fine, you're okay, but actually you're having high BPs, which can present with severe headaches, swollen feet. You can wake up in the morning and find your face puffy. You feel like your fetus is not moving the way it used to, reduced fetal movements. These are the things. And we know very well that this high blood pressure or preeclampsia has led to so many fetal intrauterine fetal demise. You find that you carry your pregnancy to 9 months, but during delivery, your baby dies, or you can also lose your life. So it's important for you to go for those antenatal and do thorough checkup. Now, for those who are diagnosed with preeclampsia, they are recommended to have enough rest. Yes, enough rest, no noise, no overworking, no stress. You should have enough rest. Then you'll be put on antihypertensives during your pregnancy and sometime after your pregnancy as they monitor. Once your BPs go back to normal, you may stop taking the antihypertensives. And then your gynecological visits will be quite more as compared to a normal pregnancy. Your doctor will request you maybe to be going for reviews after every 2 weeks, depending on how your BPs will be behaving. So that is as much as I can share with you today, but I pray that you be well, and we'll have more of these discussions, and we shall have so many discussions this year. We are here to learn and to teach. So if you have a comment or a question, just go down, subscribe, and go to the comment section, and I'll be able to answer whichever question you have. So have a blessed year and take care of your health. See you.